All right, well, welcome to Science Minds. We're really happy, we're really happy to have you. I'm really happy to have you here at the Mind Institute as a distinguished lecturer speaker. It's just amazing opportunity for us to hear all about the things that you do as a researcher and clinician. So thanks so much.
No, it's been great. The Mind Institute is so iconic in terms of research in neurodevelopmental disorders, so it's kind of an honor to be here. I haven't been here in a long time.
Yeah, well, we're glad you're here and glad the weather's good.
Yes,
and
that was perfect.
we wish you had more time to enjoy Sacramento, but anyway. So I'm filling in for Andy Dakopolos, who's the usual host of Science Minds.
Yes.
So I'm going to do my best to measure up to Andy. But I think the place I'd love to start is kind of to go in a Wayback Machine. Kind of rewind and maybe ask if you could tell us about how you first got interested in science from the beginning. I think it's really, as somebody who's interested in development and who has kids, we were talking on our way over about our kids, just hearing from you how this journey all started.
Yeah, no, it's a great question. I was actually meeting with the postdocs at the Mind at lunch, and I was sharing some of the story with them then, but I didn't start that far back. I mean, so I'm a child neurologist, so I'm a physician, and my parents are both psychiatrists who came to this country from India as the first to have gone to med school in their families. And my dad in particular knew he wanted to do research and be an academic, even at a very young age. So right after med school, when he and my mom got married, he said to my mom, "We're moving to America. That's the plan, so you got to be on board with that because I want to build an academic career and study neuroscience in the U.S." And so anyway, so that was sort of the framework in which I grew up. And I'll be honest, I have wanted to be a doctor since I could remember. I was that 5 or 6 year old who was wearing a white coat and scrubs for Halloween. And now, what I wanted to do in medicine was not clear when I was 5 or 6, but when I went to college, I became really interested in just early cognitive development and just development in general, because I was a philosophy major and I was really interested. I studied theory of mind and really thinking about how do our perceptions of the world come about, and so I kind of knew when I went to med school that I was going to focus on early child development, because I also really wanted to take care of kids with developmental disabilities. I mean, that started really early.
I wanted to ask, not to interrupt, but
please.
How did you get interested in children specifically, or development? Because you mentioned your parents' background in psychiatry.
Right.
And I don't know if they were, focused on child psychiatry.
Yes, my mom's child, my dad's adult. My dad's geriatric, so both ends.
Okay.
So, there's two answers. One is that I love kids. Okay. I've always loved children. I think kids are the best thing ever. Now I'm a mom and I definitely believe that, but I think even way back when, I always was a nanny and babysat in high school, and I just love kids. And so it never was a question mark to me that once I pursued a path of medicine that I would take care of kids. But again, what I was really interested in were these early developmental stages. And why is it that kids have atypical development? I just felt like that was something that I wanted to, maybe understand, but really try to treat more than anything at that stage. And so in med school, I decided I was going to do that. And there's 3 paths you can take in medicine. You can either do developmental behavioral peds, you can do child psychiatry, or child neurology. Yes. And so I did rotations in all 3, and I fell in love with child neurology because, the kids we take care of are really complex. They have a lot of different needs. But as child neurologists, we end up often being the primary kind of caregiver for kids, even if, say, we're taking care of them for their epilepsy or their seizures, we are still the ones parents go to for their developmental needs and their behavioral needs and, even other issues.
So in that case, I didn't really think about that before, but in these situations, it's often the case that the child neurologist is sort of the point person, and then the primary care, pediatrician is doing their job too, but maybe they're not as central as a typically developing kid. Is that right?
I think that can be true. And I mean, we have amazing pediatricians, especially at Children's Hospital. LA, but I'm sure that's true here too, who are really used to taking care of kids with complex needs. But you know, where the parents kind of trust us to figure out, like, is this a safe medication for me to try, even if it's not in the neurology wheelhouse. So I really loved that about child neurology, and I also loved that in neurology you really learn about the brain, and I knew that these developmental disabilities were rooted in the brain, and so I thought, if I'm really going to learn neuroscience, I should become a neurologist. And
so it was it just like a absolute confident decision?
Very.
Oh yeah, child neurology, because I do teach medical students.
Yes.
I don't teach them medicine, but as a psychologist,
That's great.
I'm helping them with, the psychosocial aspects
Mm-hmm.
of medicine. And I always talk to them about these decisions, and then some people are just absolutely clear, and some are just very unsure about what they want to do. So you were more definite.
I was pretty sure. The second I did my rotation, my third year, I knew, and I will say, I was at Boston Children's, because I was at Harvard for med school, so our pediatrics was all at Boston Children's, and their child neurology program is the best in the country, I'll be honest. There's amazing programs all over the country, but at that time their chief was Joe Volpe, who wrote the textbook on neonatal neurology, and he was a true developmentalist and was just like a father figure in our field. And so it's like, once I met him and he said to me, Shafali, I think you should do child neurology, that's what did it. But I will tell you that to answer your question about the science, yes. I always was like curious, and I had questions and I wanted to find answers to things. I didn't know that I was going to be largely a researcher. If I had known that, I probably would have considered doing a PhD to like actually get some solid skills from the get-go in stats and things like that. But I didn't know for sure. But my first year of residency, so now I'm like in my pediatric neurology training. It's a 5-year training. You do 2 years of pediatrics and 3 years of neurology. So in my first year, which is pediatrics, the head of developmental behavioral pediatrics, his name is Lenny Rappaport, he brought me into his office. He's like, I need to meet with you. And he said, I have a mentor for you, and you need to meet this person. He's moving to Harvard very soon, and he will be the person who shapes your career. Literally said this to me. And he was right, which was also amazing. And so this was Chuck Nelson.
Okay. Oh,
and
yeah.
Chuck
I know who that
Nelson is a
And
developmental
I was going to ask you, who
neuroscientist.
are the people that influenced you the most?
So Chuck Nelson, I met him, and he just moved, and he is a developmental cognitive neuroscientist. So he studies, at that time he was studying like typical development, meaning looking at early learning and memory, face processing and social development in babies, and was just getting into the autism space. And so we kind of did it together when he moved to Harvard, and I designed a study with him to study babies with tuberous sclerosis, because we were seeing them in clinic and we knew a lot of them developed autism, and I wondered if we could use that model of following babies prospectively to study TSC. Sure. So we started kind of thinking about it during my residency, and then right when I finished, after my chief residency year, I wrote a bunch of grants during residency, which basically paid for a 2-year fellowship with him. And that's when I really just dove into research.
Yeah, to research.
And by the end of it, I realized, like, if I really want to help patients, I need to figure out ways to answer some of these big questions.
Yeah, that's what I love about your focus, is that you have this great science background, the clinical background, and you're clearly so devoted to like the real life implications of the work for patients and their families. That's what I can tell in the passion you have for what you're doing.
Yeah, I hope so. I love it, and I think it's true for you. It's true for, I think, so many of us. I said this to the postdocs today. Actually, I said, you have to love what you do to be successful. Period. Like you just can't know it. You can't.
Find a way.
You gotta find a way, but you gotta like do what interests you, right? And for me, in the end of the day, I want to make the lives of my patients better. And granted, research doesn't answer that question, doesn't solve that problem immediately. It's a longer, and it's actually, it's funny, my mom's a clinical, they're both retired now. My mom's a clinical child psychiatrist, was at Kaiser, and my dad is an academic geriatric psychiatrist, studies aging. And they would always get into these like battles at dinner about which one's better. In terms of, if you really want to help people. And my mom would say, like, I help people every day in my clinical practice. And my dad would say, but I, can help millions with my research. And they would like battle, And I see both sides of it. I know. I think as a clinician, I have the privilege of doing both. Like, I love clinic. I love seeing patients, because they're the reason, like a question gets asked when I'm in clinic, and I'm like, what, we should figure out a way to answer. Or I can say, that's a great question. We're actually doing a study to figure, maybe if it's not me, but there are studies being done. Exactly, and I can introduce patients to, like, give them access to research that they don't normally have access to. But then on the research side, I get to work with people like you and others who are like big thinkers who can, figure out ways to solve problems.
It can be. I was going to say it is. It's not always, but it often is a really fun career.
Absolutely.
It's very stimulating for sure. I think you agree. So if I could move us forward a little bit further, I'm really interested in hearing from you. What excites you the most right now, either in your own lab and field, or maybe in the field at large, and also, thinking down the road, let's say somebody handed you, $5 million or $10 million or something, and you could really do your holy grail study, because I was just at a meeting where I was kind of trying to propose something like that. What would it be? So I guess it's sort of a two-part question.
Yeah. So what I'm most excited about is that our treatments, and particularly our what I'll say as disease-modifying therapies, are actually coming or have the potential to come to fruition. Where, especially in the genetic causes of neurodevelopmental disorders, we have this path that, and I'll talk about it more in my talk today. There's still a lot of roadblocks, but we're at a place where there's like hope on the horizon, right? That you can make a genetic diagnosis and there's actually potentially putative treatments that can be truly disease modifying, and as we do testing. So what excites me is that we're starting to move the needle to get testing done earlier and earlier. And we're hopefully getting to a place, and we need to be in the next few years, where we change the conversation with the FDA and with regulators and funders so that we can actually deliver treatments and test them early in development. Because I really think in 5 to 10 years we'll be at a place where we can make early diagnoses and start treatments. And I think I talk about the genetic space because I kind of live in that space, but I actually think a lot of what you guys do at the Mind, I mean, we can do that. We should be able to do the same with what we may call idiopathic or non-syndromic autism spectrum disorders, where babies are born, and the second we see signs of atypical development or red flags, we should be getting those kids into intervention.
Yeah, for sure.
Whether it's like parent coaching, like what Aubin does, or whether it's something a little more intensive, but something like and I think that's a taller order because it's a much bigger population.
Right, more heterogeneous, more mixed causes and things.
Exactly, and the behavioral intervention side is hard, and you need people who are trained. But I think we're all recognizing that the field is recognizing that we got to move earlier, and that there is a path towards treatment, which I just, we didn't even talk about treatment in autism 10 years ago.
No, that's true.
We literally, it was all, and when I was in Boston, we were diagnosing kids like crazy. We were even doing genetic testing, that everything was a variant of unknown significance. We didn't, so if I had, it depends how much money you're giving me. $5 million is not very much, actually. So it depends how much
amount. Just what would be the study?
Okay, so if I had, this is what I would do. I would actually do what I'm just talking about, but if I had $100 million, which is actually, because we've done the math on this I would have a few centers of excellence that have a health system-wide newborn genetic testing and screening program, where the second kids get tested and there's a diagnosis made, that they're channeled into early detection studies where we're following development, and then intervention the second it's able to be provided. Whether it's behavioral intervention, whether it's a gene therapy if they have a genetic cause. Now you could take the genetics even out of it, and that would be probably a slightly cheaper study. That would be like 75 million, right? Where you take all comers and you just get them in to an early natural history study, where again, the second there's a red flag, those kids get channeled into one type of arm of an intervention clinical trial, where no one gets nothing. And then we look at outcomes and we figure out like what works for which kids, right? We're collecting all the necessary, neurophysiological data and behavioral data so we can like profile kids well. All that will be after the fact, but that would be my dream, because I think that we're missing the window a lot of times when we're thinking about treatment.
Yeah, because some of these conditions take many years to be identified because they're very rare. Or parents' concerns are disregarded for a while, right? And so, it makes sense.
Exactly, and it should be that the second a parent has a concern, there should be something that's offered to them, even if it's surveillance. Good
luck. I hope you get this award.
Yes.
So what I would love to also learn about you is a little bit about your own personal interests. Like,
Yeah.
I know you're a runner.
I am a runner.
So
Well, I
you
mean,
could
that's
talk
a
about
soft-
that.
Yeah.
Or
Generalist term.
other things that you enjoy in your
Yeah.
life that gives you balance, I guess.
Yes.
Would be good to hear about.
Yeah, so I'm a mom of 2 teenage boys, and so that keeps me very busy. They're both competitive tennis players, so I spend a lot of time. I mean, I joke that like my best and probably only grant writing and paper writing is done on the side of a tennis court, because that's where I spend 90% of my time when I'm not at work.
Right.
I'm a tennis mom through and through, and I'm again often on the side of a court cheering on a kid, and I love that. I love being a mom, and my boys keep me very active. And yeah, I'm a really active person. So I was a tennis player in high school, and then when I got to college, I started running. I mean, nothing crazy, but I ran like, shorter races. I did a lot of half marathons actually through like college and med school.
Yeah.
And then I decided I needed to like go for the big golden ring and try to run a marathon.
Yes.
So in med school, in residency, I raised money for charity and ran the Boston Marathon, which normally you cannot run unless you qualify, because it's a really fast race. So I was able to run for charity.
So you qualified in another race
Exactly.
before?
No,
Okay.
so I didn't. So you can either qualify for Boston by
I see.
time,
Yeah.
like running another marathon really
Yeah,
fast,
right. I know about
or
that.
you can raise money for a charity and run that
that's
way.
really nice.
Yeah.
Okay.
So I ran the Boston Marathon, and it was amazing. It was like a great, amazing experience. And so I thought, I could do a couple more of these, and that's basically all that's happened since then. So I then kept running halves. I ran the LA Marathon when I moved to LA. And then in November, I actually, 10 years after my last one, ran the New York Marathon. And I raised money for the Duke 15Q Alliance, which is a syndrome that I've done a lot of research in, and I love those families. And they had a marathon team.
Okay.
So that was a humbling experience, because I didn't have time to train quite the way I had done before. But
You survived and made it
I did. And what's funny is I think because I was so scared about not finishing running, I ran it really fast in the beginning, and then my legs it was rough. The last 6 miles were rough.
I can imagine.
But yeah, my goal, I didn't really have a time goal for this one, but I ran in like 4:20, so it was not too bad.
Right.
So I'm going to run Philly, I think, in November. I think now I'm going to try to do a couple
You're
more.
kind of hooked.
I don't know if hooked is the right word. I like having a goal,
Okay.
because it keeps me active.
Yeah.
And so, and then I love to cook. I'm like a big,
like
I
to cook?
love anything and everything. I do a lot of Indian food, a lot of like Asian cuisine. I'm one of those, like, I don't like following recipes. I'll just like have an idea for something that sounds good,
Oh, I
and
wish
then
I
I'll
could
just
do
like
that.
throw a bunch of stuff together. And
I
luckily
have to
my-
have like the list, and I just follow it, and then I'm happy.
I love
I'm
that.
very nervous
Yes.
to try.
No, that's good.
different
That's actually the
things.
smart way to cook. I do
Well,
it this
I
way
know.
because I usually have like random leftovers in the kitchen, and I need to. And so, and my boys are really, really good eaters, and so that helps a lot. So they will usually eat whatever I make, unless it's like terrible, which sometimes it is. So. So I stay
great.
pretty active, and I
Yeah.
have, I love spending time with family and friends and all those kinds of things. I try to always balance, but I take being a mom very seriously. So that's sort of my when
And
I'm
you
not working.
live in Los Angeles?
Yes, we're in LA.
Like, are
I'm
you
right
happy
on
with
that-
living down south?
I love Los Angeles.
It's not where you grew up, right?
I grew up in San Diego.
Oh, San Diego. Okay, so it's not
which
that
is
different.
and I moved. So I was in Boston for med school residency fellowship. And loved it there, and absolutely could have stayed. But I just, I went to the Northeast for college, and I thought I would go for 4 years, then come back, and somehow ended up out there for 16 years. So once our kids were born and they were little, I realized it was time to go back to sunny weather. And so UCLA made a lot of sense, because they have a very successful big autism center. Dan Geschwind, who runs it, is one of my mentors, and the UC is great. Oh no! I mean, I felt lucky to be there. It's a great. It was a great place. And then I moved to CHLA, so I moved across the way just 2 years ago to take on this chief of neurology role, which is it's been a great learning experience. But and we've brought kind of all the research programs over there across town.
Wow, how interesting. I've never been there, so I have to check it out.
Most people have
sometime.
not, actually,
Yeah,
which is
yeah.
surprising, but it's because it's really largely a clinical enterprise.
Right.
It's a big children's hospital.
Right. Okay. A lot of younger investigators or clinicians, even when they see a distinguished lecturer speak, it's hard to imagine that they could get to that point in their career. It feels overwhelming, or it feels like something that's almost impossible to achieve given how competitive things are. So it would be nice to hear a little bit about maybe challenges that you've encountered along the way and how you got through them. And maybe you have an example you can think of. Because sometimes it feels like when you hear a presentation and the results are amazing,
It's so polished,
and it's so polished, and it's been a long career for that person, and they're finding really cool things to present, it just seems like easy almost, but it really isn't.
No, it's not. There's a lot of rejection along the way, I
Right.
would say. I mean, big picture, I'd say the biggest challenge for me, just in academic medicine or in an academic career, and I told this to the postdoc stay, is honestly like finding the balance. You know, kind of the work, I don't think of it as work-life balance, because I think work is a part of our life and it's important, and I think so I always think of it as like work, non-work balance, like and especially, you know, really being sort of a very intentional mom and wanting my kids to feel like they're my priority, but while still working, you know, sometimes there's weeks where it's like 70 hours with everything. And I think what I've learned is, again, if you love what you do and you're happy, the people around you, your loved ones, even if you're not spending quite as much time with them, like they see that, you know, and they see it and they respect it, and it builds a sort of, I think you end up being sort of a role model for them without having to, you know, indoctrinate them with the things that you're thinking or doing. And I also have learned that like the quality of time is really important. So like when I'm there, when I'm home or with friends or whatever, I'm not like on my email, I'm not, you know, like it's hard to do, but I think it's really, so I try, because I think many of us, especially moms in academia, there's a lot of guilt around, you know, just the time, you know. But in terms of specifics around research, I mean, I have lived through all of it. Rejections of grants, rejection of papers, you know, studies not going the way you want them to. I mean, the most recent really big hurdle, which I'm actually I tell this whole story in my talk today, because I think it's an important one to share, and it's very like recent, and I added it because I think it's like it's something that it's totally shaped actually the way I want to spend the next few years of my career, which is that, you know, I spent 10 years basically in the space of clinical trial readiness in a couple of different syndromes, but in particular in Duke 15q syndrome, which is a genetic syndrome associated with autism, intellectual disability, epilepsy. You know, we had a targeted treatment, we did all the work to get the trial ready, and, you know, everything was like, I mean, from patient engagement to recruitment to the biomarker to the endpoint to the trial design, everything was done. And 3 months into the trial, the company, big pharma company, just announced they were stopping it, pulled it, because of strategic financial reasons. And it was, I mean, I have actually not been that like emotionally affected by something professionally ever, I think. And what I had to do was like quickly pivot and figure out like, how do we learn from this? And how do we advocate? You know, we could just like decide to just put our heads down and say it's over, and we hate big pharma, or we could say let's be advocates. And so what happened was like the patient community advocated in a really powerful way. I'll talk about that today. And we're now meeting with like VC and small biotechs to figure out like how do we move forward. And actually, a few of us are writing a piece to the scientific community around like the landscape of clinical trials and rare disorders right now, and the fact that we have to change the landscape basically, so that we're not relying on industry partners to pay for, because they don't want to pay for, rare disorders don't make money, right? Like the impact on one child is to us priceless, but it doesn't make money for them.
And I'm sure the emotions are partly like disappointment for what you wanted to do scientifically and clinically, but also empathy for the families who are like just, you know, so excited to do the trial.
Yes, and we convinced them to do that. They did not want to be in research really, and we did convince them. And then, you know, we have hope is the most important, you know, I think it's just the most important sort of sentiment, if you will, that we all have to like share, otherwise we can't keep going. And so that was, and I'll, truly, like truthfully, because I'm all about justice and doing what's right, like my gut was to be a child about it, you know, and like go out on social media and like, you know, just blast and I didn't do that because that would not be the right thing to do. And I have had to learn to work. So it's all still unfolding, but you know, it was a huge...
I'm so glad you're going to share that, because that'll be very interesting.
And just even what the parents did, it's so powerful. It's a beautiful story actually, because it just shows how if you engage families the right way,
Yeah.
you actually can turn something really horrible into something positive. And actually, that's what I think in terms of your question, like, and positive, I mean, I'm, you know, at least an experience that you can grow from, you know, and I think that we often take like the simplest examples of like a grant getting rejected as like, oh my God, this is like, you know, an indictment of the quality of my work and that I'm a bad person and I hate the reviewers and you can go through all that, but then after that, you have to take a step back and be like, well, what did they? Never thought that. Never. No, me neither. And then you write your draft of like what you're going to say to the reviewers, and you throw that away. And then, but when you really read through it, it's like, you know what, this is actually helpful.
Yes.
Like, this is something I do need to probably do.
Yeah,
better.
You have to acknowledge the weaknesses.
And then you get better from it, right?
Absolutely.
And so I think that is, I think any hurdle in our careers, if we can't do that, we're going to be broken before we even like get anywhere. So
developing the tough skin is tough. It's really
Yeah.
hard. Well, thanks so much. This was a lot of fun.
Yeah, thank you. It was fun.
I feel like I could talk to you for another hour.
I know, me too. And we still have half our coffees left. So.
Yes, and now I'm energized to hear your talk.
I know. Oh gosh, and I'm energized to give it. So that's good.
Okay, good.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.